it was not an easy situation in this case with Mr. Armstrong. It's someone who's close to us, we've worked with for a long time, and to tell him after all his hard work that he was going to need to lose the arm was difficult, very difficult. I think I was also touched by his response that he would do this again, even knowing that he would lose his arm because it had been a significant 8 months of his life. He would want the hand retransplanted if he could. So I feel positive that Mr. Armstrong will come through this. His loss is also our loss and is not easy. He attached to this hand as his, and now he has to give it up again. There's going to be emotional upset and turmoil as he goes through the stages of loss. Dave understands this, he's strong. He is looking forward to a day that he can be reconsidered for possibly redoing it. And one of the most touching and painful for me statements was, he said that the 8 months with his hand were some of the most significant in his life, and if he had to do it over again, knowing that he would lose his hand at 8 months, he would still do it. This was either caused by failure of blood flow to get in, obstruction, a mechanical problem, or it was caused by the immune system attacking the hand. And at this point, we have to wait for laboratory values to come back and some studies to come back to know the difference between those two causes. He began to show signs of loss of circulation in the hand. That led to us starting to do tests to confirm it, which showed there was loss of circulation. And then we started working on two issues: what was the cause and how will we treat it? The first thing we did was try to correct a structural problem that was observed in one of the arteries. The tube that brings blood flow into the hand showed that it was constricted. And so the radiology department here at Jewish Hospital put a balloon in and tried to expand it. Although they corrected the problem, it didn't increase the blood flow to his hand. So that was the first thing we did. The second thing we did was surgery to try to rearrange the plumbing, so to speak, to get more blood flow into the hand. Whether we continue to do hand transplants, the answer is yes. However, we're not going to do anything until two things take place. Number one, we need to get the answers as to what happened. And then number two, we need to go to the governing bodies that oversee complications and seek their permission. Once those two events have taken place, then I feel confident we'll move forward.